What type of metronidazole do you use, Ziv? Is it aqueous or is it compounded?
Great question. Wow, I love the word aqueous. That means liquid, like watery.
Water, yeah, that's back to chemistry. I remember aqueous.
Yeah, yeah. I think my assistants are using aqueous. Aqueous.
I like that word.
Don't get hung. Yeah, me too. I kind of want to say it again and again. but don't get hung up on it, guys. Don't get hung up on it. Clean surgical technique, sterile instruments, sterile bone graft, a clear surgical site, proper flap management, proper antibiotics and medications. You probably don't need it. I think it's great to use it, but it's not critical. It's not mandatory.
One doctor is asking, why don't you use Densah Burs, Dr. Simon?
Why don't I use Densah Burs? Well, I don't know. I have nothing against them. I think the Dr. Hawe, who invented that technique, and my friend Ziv Mazor, who is, like, to me, the best surgeon in the world, especially in the field of sinus lifting, uses it all the time and promotes it. I feel that if they promote it, it's probably great. The advantage of Densah Burs is bone quality, period. It's not necessarily for the sinus lifting. It wasn't invented for that. It was to improve bone quality. Here's the facts of life. Bone quality is not the biggest problem in implant surgery. Bone quality is not the biggest problem in implant surgery. It's bone quantity. Quality, you can under-drill. You can prepare a smaller osteotomy, place a larger implant. You get better quality. You get better retention. You can use osteotomes to densify the bone. You can use osteotomes to densify the bone. You can use the Densah Burs for that as well. So I feel like if it's just the quality, and quality is not my main issue, I'm not so hung up on it. Maybe I'll get them. I feel like, Rashad, I want to get them just to have them in my office so I can tell, yeah, I have them. But I have nothing against them. I think they're great technology, but don't get hung up on that, because in order to do great sinus lifting, you need to know the anatomy, you need to know the steps, and you need to use the technology, whether it's simple as osteotomes or Densah, very carefully as well. But keep those questions coming.
Different strokes for different folks. I mean, some people use them, some people don't, but yeah, it's good to try them.